Welcome to Raaonline. Today's topic is clinical embryology. So we start with the structure of ovum at ovulation. The ovum that is shed from the ovary is not fully mature. It is a secondary oocyte and it is undergoing division to shed off the second polar body. It is in the process of division. It is surrounded by zona pellucida and some cells of the corona radiata can be seen sticking on the outside of the zona pellucida, and no nucleus is seen under the microscope in this, as the nucleus has been dissolved for the second meiotic division at the time of ovulation, and a spindle is however present. Between the cell membrane or the Vitaline membrane and the zona pellucida, a distinct perivitaline space is seen, and the first polar body lies in this perivitaline space between the zona pellucida and the oolemma. The ovum is a very large cell. It is 100 to 120 microns in its diameter, and in contrast most cells of the human bodies are micrometer. And oocyte is a diameter of 200 micron. Oocyte which is more than 200 microns is called as a giant oocyte. The shape of the oocyte, the situation is different with giant oocytes. So giant oocytes have 200 microns. And giant oocyte is a tetraploid oocyte 4N before meiosis due to their origin, because nuclear but no cytoplasmic division in an oogonia or a cytoplasmic fusion of two oogonia. So a giant oocyte should never be inseminated, and these giant oocytes may also contribute to digynic triploidy, and they must never be transferred. Although the presence of at least one giant oocyte in a cohort of retrieve eggs has no effect on the treatment outcome. So if we just get one giant oocyte, we should just neglect it and we should not inseminate it. Now coming to the shape of the oocyte, sometimes the oocytes can be ovoid in shape. The ovoid shape of the oocyte was reported to be associated with the delays in the in vitro parameters, and rarely some two oocytes can be found within one follicular complex. And each oocyte is usually surrounded by a zona pellucida, but the zona pellucida immediately between the two oocytes is commonly shared rather than duplicated. So it is not uncommon for these conjoined oocytes to show different nucleolar maturational stages, and it has been suggested that such oocytes may play a role in producing dizygotic twins. However, even when both of the conjoined oocytes are mature, it is rare that both fertilized and no pregnancy have been reported from these conjoined oocytes. And this ovoid shape of oocytes can also be related to the suction pressure in the oocyte pickup needle. If we use too much suction pressure while aspirating the oocytes, it might distort the shape of the oocytes to ovoid. Now, a critical oocyte size is necessary for resumption of meiosis. At the beginning of oocyte growth, the size is determined by strong adhesions between the oolemma and the inner zona surface. So the oolemma is the cytoplasmic membrane of the cell, and there are strong adhesions between the oolemma and the inner zona surface. And the mean ovarian diameter of metaphase 2 oocytes which have extruded one polar body is 100 microns. But it may vary substantially, but it is not related to fertilization or developmental quality of human ICSI embryos at the cleavage stage of development. Now this is again a picture where we see one oocyte of 100 micron. This is the zona. This is extruded polar body, so it is a metaphase 2, and these are some corona cells around the oocyte. Now coming to the oogonia, what we were talking about. So this is called as the germline cell, which is the diploid cell. This is the germline cell or the diploid cells which undergoes meiotic divisions to form the primary oocyte. Primary oocyte is diploid and it undergoes first meiosis and extrudes out the first body to find the secondary oocyte, and this is the secondary oocyte is the stage at which the ovum is released. Okay, then at the stage of secondary oocyte, as it is waiting inside and after the sperm enters inside, it gives off the second polar body after the sperm enters inside, and that's when the second meiotic division is completed, after it meets with the sperm. And then That is the time when zygote is formed. So, Ugonia stage is this, which is diploid. Now coming to the parts, so parts of ovum are the corona radiata, the outermost part, the zona pellucida, the yellow part, the perivitelline space, okay, the space between the zona pellucida and the lemma, which has got dense adhesions, and this is the vitaline membrane. Now these are the follicle cells of the corona radiata, and this is the cytoplasm of the oocyte. This is the nucleus in the oocyte. This is the vitaline membrane of the oocyte, and vitaline membrane and the zona pellucida. This is a hypermature oocyte. This is an immature oocyte, and this is a rightly matured oocyte. Now, how do we compare the male and the female gametes, the sperm and the ova? The sperm is 3 microns, whereas ova is 120 microns. The sperm length is 60 microns. The ova is spherical, so 120 micron. The shape of the sperm is adapted for motility. The shape of the oocyte is adapted to provide ample storage of nutrition for the embryo formed after fertilization. The sperm is motile, highly motile, whereas ovum is immotile. There is a very little cytoplasm in the sperm, whereas ova contains a large amount of cytoplasm. Chromosomal types in sperm can be a 22 plus X sperm or a 22 plus Y sperm, whereas oocyte is always 22 plus X.